program that they've got out there in gerontology. I'm not sure how new, but it's great because there's not a lot of those programs around. So she's going to go ahead and speak to you today. Maybe she'll tell you a little bit about the task force on elder domestic violence, and we'll go ahead and welcome Yvonne Lozano.
How much time do I have? So I can keep track.
Lunch is high noon.
50 minutes, high noon.
We're
Okay. Well, I'm glad to be back, and can y'all hear me? I have the voice for that, but as well. Sometimes I get too loud, so you need to tell me that too. But I'm actually, this is my, I want to say, third or maybe fourth time to present, and always look forward to coming to the Institute to do so. And more importantly, always look forward to seeing those of you that are here, because as you know, gerontology is, not a sexy field. Neither is geriatrics. It's what one of my patients used to say. She said, it's not sexy. Learning about it isn't sexy. Everybody wants to work with pediatrics and babies and, drug addicts and juveniles. A lot of people, that's kind of the area, especially when you look at social workers, or, that's kind of the area that they particularly look at. But just to tell you a little bit about myself, I'm a master's degree in gerontology from Baylor University that I got in 1988. And I'm currently in my third year of my doctoral program in gerontology at University of North Texas. And taking stats this summer, and just beside myself right now. So everything I see, even how the lights work, I'm thinking about numbers and stats. And so I have to just get back into the fun stuff in my life. So it's making me crazy. But I'm glad to be here, and more importantly, because this is one of the possible dissertation topics that we're going to work on. And that's domestic violence in the older, particularly the older woman. And about, in 2000, a couple of people from San Antonio got together from one person from the police department, one person from the DA's office, and said, we really need to start looking at the issue of domestic violence in the older adult. Now, when you think of that, people think, well, we know there's obviously abuse of adult children to their older parents or older grandparents or older aunt and uncles. We're aware of that. We're aware of exploitive issues. We're aware of different issues in particular regarding finances. And those things are numerous, and they happen every day, every second of the day. If you go to Adult Protective Services here in San Antonio, you'll find out what those numbers are for Bexar County, and they're absolutely astounding. We're going to talk about a few of those today. But I particularly want to focus on domestic violence in the older adult per se. And the reason that what we did is we got this task force together in San Antonio. It's called the it used to be called the Older Battered Women's Task Force, and you can imagine what that particularly did, because we realized that we didn't need to just focus on women, although that was a goal for most of us. So we changed it to the Task Force on Elder Domestic Violence. And every year in August, we hold a conference in San Antonio. And so I hope that some of you will attend that. But in particular, we want to look at this issue. And I'll give you a couple of stories. So we've been together since then. We have an annual conference. And our ultimate goal, and then we'll have a goal after that, of course. But right now, we're working on a shelter in San Antonio for elderly victims of violence in particular. Do you know there's not one in San Antonio? Do you know there's only 4 in the nation? Now, we're talking about domestic violence. Battered Women's Shelter will tell you that they will take the older adult. But the minute that there's any complications of any sort, whether it be physical and or mental and or emotional, they refer them back to Adult Protective Services. So there really is no shelter any longer. There used to be. It used to be called Centro de Barrio, but it's not here anymore. So there is no shelter. So our goal is to try to do a needs assessment, do a survey, whatever we need to do, and everybody's interested in giving us some money, but nobody's interested in following through yet. We have to show them that there's a need. No one believes that there's a need. It's like I tell people, no one really believes that our grandmothers, that our older parents are actually still in abusive relationships. Working after I left graduate school, I worked for 3 years as a counselor in the jail here in San Antonio, because no one knew what gerontology was when I went to apply at a hospital. They're like, well, are you a nurse? And I was like, no. Or are you a social worker? I said, no. What do you do? So I told them what I did, and they said, well, we don't have anything for that, but it would be great if you had some kind of license. So I went and got my LMFT license, Licensed Marriage and Family Therapist, and so then people started to look differently. So I ended up being the director of a Gero-Psych program years later, and I did that for about 16 years. So my background is mental health and aging. And I started to notice the number of women, older women, that came to our facility that had a history of domestic violence. One in particular, she called herself, she drew pictures of poodles with mohawks. She was psychotic, and what she was trying to tell us was that that's how she felt, because she was tired of being mistreated. So now, instead of being a nice little poodle, she became a poodle with a mohawk. And what she did is, the reason that we got her is because she had a psychotic break, and she stabbed her abusive husband in the back while he was watching Wheel of Fortune. Because she said, I'd had it. And he had been verbally abusing her, and emotionally abusing her, and physically abusing her. And she married him since when she was 17 years old, and she was now 76. So do the math, because I'm not doing that right now. So she all those years she stayed in that relationship. So she was one of many. Some wouldn't speak of it. More importantly, what I began to notice is that the family, a lot of the time, was not aware, whether they were in denial or just didn't admit it. They weren't aware at all that this was even occurring. The adult children still stay in denial no matter how old they get about what's been going on with mom and dad. A lot of times they're saying, well, he never hit her. But mom would say, you don't have any idea what he did. You don't have any idea how he talked to me. Whatever the situation may have been. The pattern of assaultive and coercive behaviors is something that we look at when we're defining domestic violence. It includes physical, sexual, psychological attacks, as well as economic coercion. You will see this a lot through Adult Protective Services. We saw it a tremendous amount of time working at the Geropsychiatric facility, because now what we're doing for these women is we're treating them for anxiety disorders, clinical depression. We're treating them even for psychotic episodes, untreated depression, and more importantly, we're now treating them for post-traumatic stress disorder. It wasn't until one of our geropsychiatrists said, you know what? You know what these women have? It's post-traumatic stress disorder. It's PTSD. And we find out that if it wasn't coming from within the relationship, it was coming from something that happened to them in their past, traumatic. Usually it was sexual abuse, something that happened to them at an early age that they never dealt with. I don't know if you ever heard of a woman by the name of Naomi Feil. If you're a social worker, you may have her, and she's a social worker. And she developed a method of therapy called validation therapy. What Naomi says about validation therapy in the older adults, her specialization is geriatrics, is that if you don't take care of your stuff now, it will take care of you later. So, a lot of these women that we would see in their late 60s, early 70s, mid 50s, some of you can relate to that, some of you can't. A lot of women that we would see in their 80s and 90s were suffering from post-traumatic stress disorder. We'll talk a little bit about that. Adults or adolescents. The other one is that adults or adolescents use against their intimate partners and family members. What we want to remember is that this is not just occurring for someone who is married, but can happen in all types of relationships. And we're focusing on intimate partners because the tendency is to say, well, you know, we've already got so much of that going on because we're covering that in Adult Protective Services. Adult Protective Services is looking at that. But a lot of physicians, a lot of nurses, ignore the fact sometimes that there could be that domestic violence with the older couple. Because what do you see? You see this nice little older couple coming in. He's got a big old fishing cap on and with suspenders and overalls, whatever your ageist views of what they would look like might be. And she comes walking in and they seem like a nice little couple. Then you might notice things like, he doesn't let her answer any questions. he tells you what's wrong with her. She tells you those bruises are once again because she fell. And you have a tendency to want, the tendency is to want to believe them. Because why? Because they've been married for 60-something years, 70-something years, 50-something years, 40-something years. What we look at when we're looking at physical and sexual violence is we look at things, and these are really great little tools and specifically to look at in any type of assessment. And I want to also mention this is not just something that physicians or nurses are going to do. Social workers are going to look at that. Even in dental, I mean, my dentist is all the time giving me like 5 cases to review with him every 6 months when I go see him, because he's got some things going on in his office related to his older population. So economic abuse, male privilege, this is something that has come along in life when we look at how that generation, I want to specifically talk about that generation. When I'm talking about that generation, I'm talking about 65 plus. And the reason I say that is because there's a tendency for the males in the audience to start saying it's not that way anymore, it's really changed, and it may have, and that's another class and another discussion and a beer. So, you know, we can talk about that another time. Isolation, a lot of times you will see these seniors that don't have anything to do with anybody else except the people that they are living with in that home. They isolate themselves. Sometimes it's not by choice that they isolate themselves. Sometimes their partner has isolated them from everyone. Their partner's the one who's complaining all the time about that family member. Why do you want to go see your sister? Why do you want to be, why do you talk to her so much on the phone? So they start to help them kind of get away from that. What is the person who is committing the act of domestic violence trying to do? Control them. They know that if the more interaction they have with other people, the chances are they're going to start talking, but they want to control every aspect of it. So emotional abuse, threats, minimizing, denying, and blaming, economic abuse. This is all the cycle that we want to particularly want to look at when we're looking at domestic violence. Power and control. Even my mother the other day, she was talking about this case that she read in the newspaper, and she said, I just don't know why these women just don't get out. I said, because it's all about power and control. She said, no, it's not. She said, nobody lets anybody control them that much. I mean, there are people like my mother, who's a very smart and intelligent woman, who really do believe that. Who really do believe it. Just like we think that grandpa really isn't hitting grandma, or that grandma isn't hitting grandpa. Because what we saw continuously over and over again in the Geriatric facility is, here's this woman that for 50 plus years has been married to her husband, who's been verbally and physically and maybe sexually abusing her, and now what we have, he's got dementia. He's got some other chronic illnesses, and now she's his 24/7 caregiver, and she hates him. And she doesn't let anybody know. So what happens to these women? Mentally and emotionally, they either decline through depression or decline physically, because they're not going to tell anybody that this has been going on for 50 years. No one's going to believe them anyway, and it's true, because a lot of the times the adult children would come along and say, there's no way that dad had been doing this to you. There is no way. Of course, then the spouse of that particular sibling is saying, he's just like that. So it's perpetuated itself. It's my story that one of my good friends who's a social worker told me this, how she looks at people when she goes to their house. She said, the first thing I look for is a big bunch of elephant poo in the living room. What is she looking for? That everybody's walking around, that everyone's ignoring, that someone's saying, there's always that one person in the family saying, I didn't do it. There's always that other person in the family just walking around acting like it never happened. So there's a lot of people denying that there's an issue that needs to be discussed within that family, and no one's saying anything. It happens with alcoholism, it happens with a lot of different things. Physical and sexual violence. These are the things that these particular individuals, as we see this particular cycle, that there is some privilege to it. And using the children too. Brings us back to power and control. Now, what happens for older adults is that they're more vulnerable. You know, and one of the things that this does not mention, I don't think it does, that I had put on there, is that the resources have declined for them. And I don't mean just financial resources. I mean resources of any kind. I mean, their neighbors around them have died. We're going to talk about that this afternoon when I talk more about ageism. But, you know, things around them are gone. Decreased physical abilities, dependency on others. Even if you're a healthy older adult, it still doesn't mean you can defend yourself. You know, there are just some people that you don't defend yourself. Dependency on others for a lot of different things as well, not just financial dependency. Frequency of living alone, having predictable routines. One of the things that the older person does not want to give up is the routine. I know that if I report this or do something, they're not saying I'm going to have to give up my routine, but they fear that. They fear that their life will change too much and now they're too old. They have their own internalized ageism that they're beginning to experience. So, you know, I have a student, when we started the gerontology program, I was trying to recruit students, and the student said, you know, how many gerontology classes can you teach? It seems to me like you could probably get this all over with maybe in a couple of weeks. I mean, what is there to know about older people? It's endless because they're human beings. It's endless for all. There's a lot to be learned about this population. And a lot of the times, people don't want to learn it because it is so much, especially from a medical perspective as well. Onset of mental impairments such as dementia and Alzheimer's disease. You know, the older man or woman who is an abusive person, you know, that condition will exacerbate itself as they get older. So I talk about this in the ageism. If you were a grouchy young woman, you're going to be a grouchy old woman. If you were a mean young man, you're going to be a mean old man unless you take care of your stuff now. Unless you do that for yourself now. And that's the same thing that happens with the batterer. What do you think happens to these batterers? Did they quit battering because they turned 70? Did they quit being abusive? Maybe they don't punch as much as they used to, but maybe they're still verbally abusive. We had a woman that kept coming back and forth in and out of the hospital on med-surg. And finally a physician did a referral to a psych referral, and when we went to talk to her, we were able to find out that she had been in this abusive relationship with her husband for over 42 years. And what was she upset about? Is that now she was having to take care of him, and she got very depressed about it. Now, when you begin to get the dementia and the Alzheimer's, sometimes you forget. You're not really sure how to communicate this, or no one believes you. Remember, with Alzheimer's, the walls fall. That's how one of my colleagues described it, that the walls fall. So, you know, our judgment is impaired. The same thing that happens when people become intoxicated. First thing to affect is the frontal lobe where your judgment is impaired. This is what happens to the Alzheimer person as well. So the ability to be able to tell people that anything's going on or that anyone's going to believe them anyway is the other story. So what it does is it also makes them more vulnerable. The more physical problems they have, the more emotional and or mental or even organic impairments. That's a big part of it too. Reduced or no access to money, limited income as well. You know, what are they going to do? You know, I don't care if an older person has $17 million in the bank, they have no money. Because they might need it for a rainy day. And they don't see spending that $17 million on a hotel to get away from that abusive person as a good way to spend their money. I had an older patient who told me one time that her father had opened up a separate account for her when she got married because he did not quite like that boy. And he was right. And they stayed married till he died. They stayed married for over 50 years. But he had a separate checking account for her that she and the father, had access to. Up until the day after he died, because he said, what women need when they're about to mess up, is what she taught me, is a way out. And the money was going to help her. And even after she knew she had that money, which by the way had ended up being thousands and thousands of dollars later on, she still didn't go anywhere. Learned helplessness. For the older woman, what we're trying to look at, or what I'm researching, is comparing the reasons they stay versus comparing the reasons that a younger woman stays. Any questions so far? I don't mean for it to be depressing, but I think it's very important for those of us in we're going to have in the field, we're going to have any contact with any human being, especially the older adult, that we need to be able to look at some of these things and be able to assess them and bring them forward for somebody to do something about. There are different types of abusive behaviors: physical abuse, sexual abuse, psychological, use of economics, use of grandchildren or pets to control the victim. How would you do something to control the pet? This is a pet that the person who's being abused is very close to, so you don't let her see the pet or don't let him see the pet. Do things so they can't see them. Or also, we have people that never get to the hospital because the abusive spouse is not allowing them to go to the doctor. Or they take them to the doctor gives them medications, and they get home and he says, I'm not buying you those medications. Or he wants her knocked out all the time because she's got some dementia and she's confused and she's staying up at night, and he over-medicates her on purpose. A lot of times when an older person dies in the home, obviously they would call the police, but what's the tendency to believe what happened? They're old. The same thing we do when we're reading the obituaries. We kind of skip through all the 85-year-olds, 75-year-olds, and we go right to the 20-something-year-olds and to the 15-year-olds and to the 3-year-olds. Because that person has lived a long life. We don't look at things like the fact that maybe they were suicidal. Maybe someone else killed them. Maybe someone wasn't giving them their medications. Use of grandchildren too, then I'm not going to let the grandkids come over and because you did this, because you didn't cook my eggs enough, because you were talking to your sister too long on the phone again. Sexual abuse is something that's very common for this older woman and older man, and you will see it, especially a lot of older women. And I tell people, I think we're going to see an increase of this with Viagra. We're going to see an increase of this because I talk about it in my talk I do on marital issues of the older couple. And one of the things I mention is that Viagra has changed the whole persona of the couple now. Because, they've been sleeping on twin beds or separate bedrooms for a long time now. And all of a sudden Viagra comes along and he's, coming in the room at 12:05. And she's like, oh my God, we haven't done this in 24 years. And so maybe she doesn't really want to, and or maybe she does and she's glad that he's coming back in the room. But in issues of domestic violence, this may not be the particular situation. It's a way to continue to control the situation and the environment and everything around them. Keeping in mind that just because someone's gotten older doesn't mean that they're necessarily smart enough to get out of relationship. You don't have to be smart. You don't have to be intelligent to know to get out of a relationship. It's a lot more than that. Emotionally, intellectually you might have an IQ of 130, but emotionally you might be a 2-year-old, a 6-year-old, or helpless, or feeling a learned helplessness, what it's called now for a lot of women in those situations. Physical abuse includes things such as shoving, hitting, bruising, shaking, pushing, kicking, broken bones, denying food, bathing, personal care. It's a form of neglect. Adult Protective Services needs to be involved with this, especially in the patients that you come in here facility or your area and you see that this is a situation with them, we have to immediately think about assessing for abuse and neglect. Maybe he's never hit her his whole life, their whole life. Maybe he's never even been emotionally abusive to her. But maybe now there's neglect as a form of abuse. Neglect for this older adult is a serious form of abuse. Denying food even, not feeding them. You know, a lot of times you can look at issues of malnutrition. If there's someone else in the house, whether it's a spouse or an adult child or a caregiver, you have to look at those issues of malnutrition. Sometimes it takes too much trouble to help them feed, to help them eat. Sometimes if it's a healthy older person and they come in and they now are experiencing malnutrition and they're able to walk and get around, you might be thinking that maybe there's depression. Taking away their dentures, we've seen this a lot. Not giving them their dentures so they can eat, their glasses, their walker, their wheelchair, other devices that they can use. Literally taking them away and saying, you get this when I say you can have it. You'll use this when I say you can use this. We don't think about these particular issues for the older adult, do we? Controlling the access to health care. There are many of them that are difficult to think about, difficult to look at, but this is probably one of the most common that we see. A lot of times, you know, we ask people, when were you going to bring her in? Well, you know, she kept telling me she was okay, and there's the woman not saying anything, and you're going, oh yeah, right. She hasn't been feeling good for a very, very long time. Sexual abuse, coercing sex through a variety of tactics, physically forcing or harming the victim, harmful genital practices, something else that we saw common that we see in the hospital. A lot of people not really considering this or checking for this. You know, then let me just give you a perfect example of ageism and how it affects care. Internalized ageism, we're going to talk about that, how we develop that ourselves. But we had women in our Geriatric facility, not a lot, and I can't tell you how many, but we had them that they would come up with dementia, and it would be from syphilis. Now, the adult children are like, oh my God, I don't think so. And then the woman starts to speak, and she tells the story of her husband coming back from World War I to World War II, and giving her the disease. And of course, you know, she's not going to announce it to the world now that she's got syphilis, but later on in her adult life, she's developed dementia from that, secondary from the syphilis. So no one wants to believe, including the adult children, no one's going to really look to rule that out in the hospital unless there's a physician, a geropsychiatrist who really knows what he or she is doing, to rule out that issue of syphilis. Because people think that syphilis is obviously sexually transmitted, and there's no way that this older adult is still having sex because she's 90. AIDS, a new, what we call a contemporary issue in aging. Age is something that's popping up quite frequently now in the older adult. HIV. Psychological attacks is something that we need to look at. Yelling, name-calling, put-downs. You know, again, a lot of times the older adult will minimize what this is. He really or she really did have a bad day. You know, they've kind of always been like this. Now he's just kind of grumpy, and he has a tendency to kind of do this more. We all know when somebody says something to us, whether they're yelling or not, that it didn't feel very good. Do we not know that? Does that mean that a person was always being abusive when they said it? Is that what that means? What we also know is that we know when it's abusive. We know that. We know that as human beings that it didn't feel good, and we know that we can identify it as being abusive, and very unfortunately, we don't always identify it or take it any further than that. I had one of my students I teach at Incarnate Word, adjunct at Incarnate Word, and he told me, he said, you know, my roommate, who was a female, she said he beats up, she literally just pounds on her boyfriend all the time she gets upset with him. She's 22 years old. Everybody thinks it's funny because it's a girl beating up on him. But I guarantee you that there is something that needs to be looked at there in that particular situation. And again, as people get older, people just kind of ignore that it's even there or even exists. Controlling the victim's activities and schedules. No, you're not going to go, we're not going to that wedding. We're not going to that, you're not going to that baby shower. No, you're not going to the neighborhood meeting. No, you're not going to church. No, you're not going to that church activity. Or yes, we are going, but we're leaving soon as it's over. This is where the isolative behavior comes in for the older adult. A lot of times people are afraid that maybe he or she is going to have an abusive outburst, and they're going to be embarrassed, so they don't want to be out. They don't want to see this happen. Now again, remember, we're talking, we can reflect this and talk about the younger population, but right now we're talking about domestic violence in the older adult. A lot of times it's very difficult for people to look at that age group and see that this is even happening or even possible. So we talked already about isolation from friends and family, even neighbors. Now, some things to look for are violent acts even against grandchildren, animals, or others to control the intimate partner. You know, that he does something to make sure that the grandkids don't come back. Because what is she doing? She's given too much attention to those grandkids, and he does not like it. Or she doesn't like it. So he's going to do something to control that particular situation. Even with animals. We had a woman that came in severely depressed because her husband, abusive husband, killed the dog in front of her. She didn't want to report it. She didn't want to say anything. She didn't want to go anywhere. You know, it's the very thing that we look at when we're looking at children. We look at, you know, in the psychiatric world, we call it, you know, cutting off puppy dog ears, because that's a common behavior of children having behavioral problems, severe behavioral problems in later life too, as they get older, be young adults, is that they're hurting animals. Forcing victim to do degrading things. Used to see this quite a bit. Also with women that had been abused, younger women and older women as well. Whether it be sexual, whether it be, you know, I remember one woman, he made her lick all the plates clean in front of people, in front of guests, who, by the way, didn't do anything about it. And here's why. It was adult children and their kids. And here's what the adult children told us in the unit, in the facility. We had a family meeting. You know what? They've been like that all their lives. And you know, she really just kept nagging at him. So, there's a cycle. Controlling or withholding money, making all or most of the financial decision, who gets the insurance, name on the title on it. I don't know, ask your father. He's in charge of all of that. I've never ever looked at that. As a matter of fact, she's probably never even got her driver's license. Or if she did, she never really was allowed to drive anywhere by herself. Are y'all thinking of people you know, older people who you can identify some of these? You're making you think about it a little bit. Are you? Raise your hand if you are. Okay. controlling their access to health care, retirement benefits. We had a woman whose husband was a retired colonel, some kind of colonel. Not Kentucky Fried Colonel, but like a retired colonel. And he didn't leave her anything. They had 401ks. She wasn't of course, as in Texas, I mean, she got some things because she was a surviving spouse. But all their monies they had, the CDs, IRAs, he had it in somebody else's name, his son's. So there she was for years without that extra. And her sons were just like, well, that's the way Dad wanted it. Who, by the way, were also, you know, when you see them in the family meetings and the sons come with their wives and they're all sitting there and the wives aren't saying anything and listening to the story and the wives are just biting their tongues saying, I've got a story to tell you. And you see it and they walk off and you can't do anything about it. Even if you sit there and you describe to them all of these symptoms, the sons are acting like there was nothing. They don't know what that is. That's my role, that's my privilege, because I'm the male of the household. So I get control, I do get to control all these things. New companions, romantic relationships. Had a man who was leaving his demented wife next door, he would leave her at home and he would go to the next door neighbor and he was having an affair with her. And would come over occasionally to check on his wife. Been having affairs all his life. And by the way, when he died, he left the money to the neighbor. I know. I check all my paperwork. Restrict the time spent with grandchildren, family members, and church. Use of third parties. I mean, that's just the way. And if you say anything to them, you'll never see them again. You know, adult children, I've heard them say to their parents, how can you do this to the family? How can you bring this information out? You're going to ruin everything. So nobody says anything. Then what you have are those mothers teaching their daughters that why you stay in these kind of relationships. I used to hear it. If he's bringing home, the bacon and he's got a good job, you stay with him no matter what else he does. If he's financially supporting you and the children, you don't need anything else. You don't need him to do anything else for you. I guess because men with a job are hard to find, I'm not sure. Back then. I haven't really figured that one out. I'm sure there's some kind of clinical research comment that I could have made there, but to me that's the bottom line. Abusing or threatening, we talked about that, of family members, of pets, of grandchildren. Turning members against one another, very, very, very common. Taking the ones that are going to be more on your side and turning them against the others who are not. Starts all kind of, as I would call my other clinical term, shenanigans within the system itself, within the family system itself. It just continues to perpetuate the dysfunction. And remember, one of the things about being controlling is that you want to have that dysfunction because you don't want someone else to be thinking on their feet. So if you keep them in this sense of disarray, there's this book called The Dance of Anger. I don't know if any of you have ever read it. It's fantastic. And it talks about something like this, about these couples, relationships, not just necessarily couples, but any relationships where they do this dance of anger together. They've got the routine down. She knows how to manage him. He knows how to manage her, whoever was abusive in this situation. And modeling abusive behaviors to family members. Adult, whether it be sons or daughters, I mean, they see that, and they see that that's the way that it should be. That's the way that it worked. Even if they know that's not how it should be, they somehow fall into that kind of comfort level again. Restricting use of phone or listening in on conversations. Very common also for the older adult. Can I speak to mom? No, she's busy. I haven't talked to mom all week. Well, then come see her Sunday. Contributors to domestic violence we need to look for is alcohol or drugs. You can find out that information without asking the question. You can find that information without asking that question. Illness can also be a contributor. They just get frustrated, they just get angry. Anger and stress, whatever that might be, wherever it might come from. I do this talk called Anger is Upside Down Fear, because that's all it is. It's where hatred comes from. Hatred comes from the unknown, which is where fear comes from. So fear just turns into anger. You know, you hear people say, oh, I hate people with red hair. Well, they're just afraid of people with red hair. They're just afraid. There's fear where that comes. That was just a joke, but I'm just saying that, out of control behavior, especially if the person who was the victim is removed from the situation, you're going to see out of control behavior from the abuser. Because they know that their party's about to be over. And we have stories of men that would still go to the nursing home to visit their wives and abuse them there. Verbally abuse them there. Emotionally abuse them there. Belittle them there around people. See, you're no good anymore. You're living here now. I mean, you hear it all the time. Behavior of the victim or problems in the relationships. These are things that you can particularly, start to look for. Maybe there's a history of this kind of abusive behavior since they were a kid, or the cycle has just continued. All of these things are factors to look for to see what's going to contribute to domestic violence. I'm kind of moving on now because I want to get to the little questions. Intergenerational cycle of violence. I mean, that, it starts from, the youngest person in the family, and it gets passed on, it gets passed on, it gets passed on. It just never stops. Barriers to leaving because they're perpetrators controlling anything. Who are you talking to? Why are you talking to the mailman? Why'd you open the door? When you think about how horrible it can get. I mean, I don't know if you remember that story of that man who had chained his wife to a car in a driveway for people to see her because she had misbehaved. Here in San Antonio. And over and over and over again, we continue to hear stories of domestic violence, of mental illness, all kinds of things going on. The woman who recently just killed her boyfriend and the 2 children, not necessarily that had to do with depression and untreated depression and stress from her, child. But we read stories like that in the paper, and I keep writing this letter to the editor, and it never gets printed. I send the same one. Y'all know I've been doing that. Y'all don't know that. Of course you don't know that. But I've been doing that for about 4 years, and it's to tell them, when are we going to quit here? If we're going to continue to listen to stories like this, when are we going to start hearing about what to do? Where to go? Because there's someone reading that story that's going to say, oh my God, I don't want that to happen to me. And there's nothing there at the bottom. There's nothing to tell anybody what to do or where to go for help. No matter what side of the situation you're on. You see it on the news all the time. My God, if there's a dog that's lost, everybody's got that phone number of who to call. If there's a couple of dogs that almost drowned, everybody's got that phone number to call about those drowning dogs and where to get one and adopt one. I like dogs. I have a dog. I'm just saying that we've got to put some information out there. This is what this task force is all about that I'm a part of. The victim overwhelmed by physical and psychological trauma and fear, just overcome with fear. So fear, that's what it's all about. That's what control is all about. I want you to be so scared of me that you be and do who I say you will be and do. And you know what? Some people say there's got to be, love has to have something to do with this. Maybe she does, or he does really love her. Maybe that's what it is, and she doesn't want to leave that. I guarantee you, as many older women as I have talked to, that love has no part of that. you know, at the beginning, you know, this is what I had a friend of mine who's a therapist, and I tell all my students this. I tell them, 12 dates and no red flags, you got a good deal. But if you've been on 12 dates and you're seeing red flag after red flag after red flag, and you're still dating that person,
That's a red flag.
that's your red flag that you got to take care of business for yourself. People go, oh, it just happened once, or it was just one thing, or, you know, he's going to get a job, or, you know, the average age now for the male to leave their home is 28. How many of you want to go out with a 28-year-old guy or woman that's still, you know, what's that about? Anyway, that's another subject and another beer. Lack of continuous community and family support because the community is not really acknowledging it, doesn't want to talk about it. Lack of money, embarrassed. You know, my grandmother used to say she was a woman way ahead of her time, the whole reason I do this whole stuff. And she was a divorced woman, left an alcoholic husband, and took 4 children and raised them herself. She was, you know, she was born in 1920 something. So 1918 something. How many people would do that from that generation? She used to say, you're not going to get to know anybody just standing on their porch. You need to get inside their home. Because she used to refer to women who would just, years ago, would sit on the porch swing and they would be supervised by somebody watching them swinging on the porch, and then they were like, okay, Sunday you're getting married. It didn't happen that, you know, that needs to happen very differently. Everybody gets in love with the idea of being in love and forgets the fact that there's some guys over there raising flag after flag after flag and telling you to stop. And you're like, oh, but he's so cute, and he's so this, and she's so that, and then you're like crying 6 months later going, how could y'all have let me do this? Well, they did everything but just pluck you off the earth and take you away to get away from the situation. Deteriorating health plays a part. Red flags, here we go. Repeated accidental injuries that you see over and over again doing an assessment, appears isolated, has limited or no access to others. You need to ask these questions or look for these answers. Says or hints at being afraid. What are you going to see? From a mental and psychological perspective, you're going to see increased anxiety, inability to sleep, inability to eat. You're going to see clinical depression. When you see those things, does it always mean they're being abused? No, but do you need to look for it? Absolutely. Absolutely. Considers or attempts suicide, exhibits self-neglect. I'll just quit taking this medicine. I'll just quit taking the very medicine I need to keep me alive. History of drug abuse by one or both parties. I call it, you know, I tell with older people sometimes when I walk into their homes, I tell them it's a joke, but I mean, I saw it happen to one lady, Dixie cups, vodka in the Dixie cups. Why? They hide it. Everything's hidden. Presents as difficult client or patient, has vague chronic complaints, unable to follow through on treatment plans. I don't really know what's wrong with me, but I kind of feel, I don't know, I just really can't tell you. I know you've done every test there is. Exhibiting depression and any history. So I'm going to have to stop there, but any questions? Let me leave it on this so you can read it. Any comments, questions? Yes, ma'am.
Of what we can do about all this stuff, do you have referrals?
Well, that's a part I do want to talk about. Here's what we don't have, and here's what we don't have in San Antonio. There is no number in this city that I can give you to call to report. There's a number I can give you to report Adult Protective Services, Department of Aging Disability Services. Let me turn this next slide. So you would call, let me get to that. Sorry. Here you go. Unfortunately, the battered women's shelter, they're going to ask you a lot of questions about her or his ability to be able to maintain themselves in that home. A lot of times you're not going to see that. They don't have anybody to help with medications there. They don't have anybody to do any of that. But you still can call these numbers. You have a responsibility, an ethical responsibility to always report any suspected abuse. Because the worst thing that can happen is what? If you report it, nothing happens. There is no worst thing that can happen. The best thing that can happen is if there is some abuse of sorts that you can manage that. Go ahead.
What if you talk to people that are being abused and they know it, you know it, everybody knows it, but they just stick with the same person? I mean, you.
Well, you know, you can't do anything about that yet, but what you can, you come out an older person?
Sometimes an older person, and I know some younger people as well.
Well, sometimes if you get them around like-minded people, maybe get them to the battered women's shelter where they have some support groups, where you can get them involved in that. Remember, you don't want them to leave the person. This is what I tell people. You can talk to them about leaving the person and then leave it alone. But what I try to tell people or help them do is to feel better about themselves. I become that catalyst to make them feel that they have the power to move on. Because remember, they're not going to leave the person if they don't feel like they have the power to move on. Like they have the power to do anything. So why tell them to leave if their power has been just completely eliminated? I don't know if that answers your question. Sometimes you just have to call the police. Anything else? Okay. Oh, go ahead.
What is the Family Justice Center? What can they do or what?
The Family Justice Center is out of the DA's office.
Okay.
And they help anybody who's a lot of women involved in domestic violence issues. How to get restraining orders, how to, file charges, those kind of things. That's out of the DA's office, Susan Reed's office. Okay, we'll see you this afternoon.